So, folks, we do appreciate you taking the time to be here. It is live, though, so be sure and use that question box. The reason we have you type in where you're from in that question box is so we kind of know that you can hear us, but we also want you to know where that question box is. Because these webinars that we do on Wednesdays about our business and about business in general are all about you and making sure that you get what you need. And that means that you need to be able to ask all the questions you want live.
Exactly. First of all, Patrick, before we actually get into the actual topic of what we're going to be talking about today, about how we can help doctors while building a good business here in the background, you and I were talking on Monday and throughout the week, and we really noticed two major articles that have come out. Now, folks, what we would like for you to do, you can see at the top, right underneath that heading, it says healthcare finance, but at the bottom, we actually have the reference where we've got these articles from. This one just came out just a few days ago, and this one is, Patrick, is right up our alley. This was written by the editor-in-chief of Healthcare Finance, and he entitled it Profit. Administrative Pressures Drive Physician Practices to Sell, though more plan to go it alone. Survey finds, and we're going to get into what some of these surveys find. So I'm going to flip this, and I'll let you kind of coach us in what you're reading through here.
Well, look at the subtitle there. The report found declining reimbursement was the top challenge for practice owners. Folks, we've been saying that for the past, 8-10 years at least, that
Exactly.
is the problem that's out there right now amongst doctors, and that's why some of them are selling their practice. They don't know what else to do, because when your cash flow goes to the point where you can't really afford to pay your people and add new equipment and change the technology that's required to keep a doctor's office running, what else do you do? So the good news is we've seen people from our licensees, seen doctors who have sold their practice, and then later on they decide to reopen it because they had to go to work for a hospital and they became an employee with all kinds of restrictions on their income and their time and everything else. So,
yeah, Patrick, that's what a lot of doctors think about doing too, is going, and I know maybe some questions that might even come up later, and that is, well, what about doctors that are leaving their practice and going with hospitals? Well, it's the same problem. Whether they're selling their practice or joining a group practice like a hospital, these are the reasons why. I mean, first of all, in this first graph that we see here, that 40% of some of the issues that are driving the decision to sell their practice is too much administrative work. 40%.
yeah, look at that. The very first thing, the biggest thing that's, by the way, they misspelled the word sell there, didn't they? It says
Mm-hmm.
drivers behind the decision to delve. This is right out of that magazine, so it's not our fault. It's because of too much administrative work. Now, folks, that's because doctors and their staff are not just seeing patients, they're having to deal with insurance companies and government agencies and all the paperwork involved with that. And that's what you can help with. You can become what we call a medical revenue manager through our training. You become certified at the end of the week of training here, and you take that over and handle that for the doctor. So you're taking that biggest thing there away from them needing to think about selling their practice, and that's the administrative stuff.
Exactly. And then the two right there close to it is profitability challenges and then the pressure of regulatory burden, such as the ICD-10. I know that a lot of people have asked us, Patrick, now that ICD-10 has already come and gone since October the 1st, is this still going to be a problem with doctors? Well, of course, folks, this article just came out November the 12th. So there is a lot of help that doctors are needing. So hopefully those that are on the webinar today see what value actually you can able to help bring.
And this is why we've seen more signups from our licensees since October 1st, is because doctors are realizing that their reimbursement is going down because they don't know what they're doing with the new codes. And fortunately, we have the solution for that. Our technology has all those codes built into it that allow the doctor to choose and pick from the new codes and get their reimbursement correct.
Now, this going on with this particular article here. This is the second figure that they've got here. So, Patrick, why don't you take it from here and just kind of tell us what we're reading here?
Yeah, so I'll just read what's up at the top there. The index shows that physicians continue to grapple with declining reimbursement, rising costs, and regulatory changes. However, they're actively investing in new ways to shore up their practice operations and boost profitability, with technology playing a key role. And Eric, we've been saying that for years now, that our cloud-based system that has all the things that a doctor needs to get their revenue where it needs to be and be reimbursed for every penny that they're due from the insurance companies. This is why doctors are ready to invest in that kind of thing. And many doctors, as our licensees tell them what we can do, switch from their current systems to our system because it's that much more advanced.
Right. Well, we see the first, this figure is showing the key challenges to practice profitability. Their biggest problem is declining reimbursement, 62%.
Yeah. Followed by the rising costs and the changeover to ICD-10. See, so all that's tied together. That's why we tell people that those ICD codes that came into effect on October 1st, the new ones, took them from, I think, 16,000 to about 73,000 codes. So what is that? Maybe 4 times as many codes. This is causing the doctors to put in the wrong codes, which means they get reimbursed less money than they could if their codes were correct. So all that together. But even just the declining reimbursement is a huge problem for doctors. Folks, that's what our business has been about for the last 21 years, helping doctors get that reimbursement where it needs to be.
Well, again, Patrick just said it all right there. You know, that last paragraph, he kind of summed it all up. But, you know, that report is finding that declining reimbursements was the top challenge for physician practices. So here's the question: how is this going to roll over into 2016? So here we're at the close of 2015. We actually found another article, again from the healthcare finance area. This one's very interesting because it's showing that this is not stopping.
No. This particular writer, Susan Moore, she's an associate editor. She says, completing the cycle, healthcare finance execs see 2016 as the year of integration for the revenue cycle. Now, some people don't understand what that revenue cycle is and all that it involves. And folks, all you need to know is that it's everything that has to do with what the doctor gets from the insurance companies, from Medicare and Medicaid, and from their patients. All that is revenue for them, and it has to be integrated into what we call the revenue cycle.
Exactly. And this guy starts off here, they don't call it a cycle for nothing because, again, it's everything from the patient seeing the doctor to getting those services paid, and whether it's going through the technology part or the financial part or even at the patient level, this is an area that needs streamlining. So that's the issue. And our system actually helps with that. And I love this last part right here. And then we'll actually start getting into some of our slides for the webinar today. So Patrick, let's kind of wrap up with this and seeing what 2016 looks forward for all of us.
Yeah, so he ends up by saying a complex system for revenue creates a lot of room for waste. That's why most healthcare finance managers are making 2016 the year of integration in the revenue cycle, whether it's by tightening the operations or by involving the patients more in the financial side of their care. Eric, we've got all kinds of solutions, which we'll talk about later, that help those patients decide how they're going to pay their portion of the bill and put in their information themselves directly into an online patient portal that ties right in with our system. So it eliminates all the human error of the people in the office taking a piece of paper that the patient filled out in the office and putting it in. The patient themselves is putting the information in, so it's probably accurate, or more accurate than it would be otherwise.
So I just posed this question here. So out of everything that we've read so far, what is this telling us? What is this telling you, Patrick, and for everybody else? Well, I think it's telling us that there are still a lot of worried doctors that are out there.
Yes, it boils down to this, folks. You can help the doctors in your area to get past all this, because what they should be focusing on is their patients. That's their core competency. That's what they were trained to do. And that's what their staff should be focused on as well. Not the billing. Turn that over to somebody who's been trained to handle that, like yourself, after you go through our training. who can handle that, not just for that doctor, but they do it for several doctors. So they become experts in it. So you can become the revenue cycle expert in your area to help those doctors get past all that worry about that stuff.
There's a question that came in. It's a great question here, and the question reads, is the business model to work as an intermediary between doctors and insurance companies? And it really is. You are the conduit in which the doctors are paid. If you think about it, that's what doctors are trying to do right now. That's what Patrick's talking about. They're trying to see patients. They're trying to manage their own office to make sure that they're managing all the claims. That just doesn't work that well. And so what we're going to present to you today is a little bit of how all this is going to pretty much work together. So it really comes down to, who out there can help. Well, obviously, there are medical billing companies out there really ready trying to help out with, but what we're finding is you, as an ABS licensee, as we see here in this particular format here, plus American Business Systems, you're the one that's going to be able to help these doctors.
Yeah, so Mebu, what this means is, you're right, that question is good because you are the intermediary, but don't think of it as being somebody who has to negotiate or argue with the insurance companies. What you're doing is following up on the claims that are rejected, though, that are denied by those insurance companies. Because believe me, they want that money in their bank account. They're going to do everything they can to deny every claim that they can, and hope that you don't have the time, or the people in the office don't have the time to go back and figure that out. You'll be trained to do that. That's why, folks, we take the average rejection rate nationwide is about 34%. Of all the claims that are sent in, 34% are rejected, denied by the insurance companies. You're going to bring that down, according to our statistics nationwide, with all of our doctors, thousands of claims every day, less than 2%. Now, imagine what a difference that would make in a doctor's revenue.
Exactly. And the way in which you're going to do that is utilizing either one or two or all of these different services. We have each one of these services that can and actually help the doctor, whether it's iClaim or EMRX, those two boxes you see there, or the Audit Guard or the CodeWrite. Those where doctors might need some help with their coding. And it's not that you are a coder, you have the service for coding. So folks, when you become part of American Business Systems, you come fully equipped to handle everything that doctor's office needs, along with our support, along with the 21 years of experience that we had going into 22 years. That's why people are joining us here and building very successful businesses. I know that, Patrick, you're looking forward to actually next Wednesday interview someone that's been around for quite some time that basically uses every one of these services. So that's going to be exciting to hear next week.
Yeah, and look, these services may not mean anything to you right now, folks, but you can go find out more on our website. And if you fill out the form, I think one of the orange buttons takes you to what's called our virtual brochure. We go into detail on each one of these, so be sure and take time to go through that, and then call your business development coach here at ABS, and we'll guide you through understanding each one of those. Those are services that we came up with because the doctors need help in a lot of different areas, not just the billing.
Exactly. And again, before we get any more further into the webinar today, we also want to remind you that you can type in your questions because this is, again, for you. So type it in your questions because, again, what we're going to take you through, what specific value can I offer as a medical biller? That's what we're going to kind of dive into right now. But first of all, we have to figure out, what the needs are before we provide the solutions, which certainly provides that value. So we're going to kind of go through each one of these. I think, Patrick, a lot of people want to say, I know I have the value, I know that you need my services, and that they try to push that before they actually uncover the need. Now, I know what we're kind of talking about here is what you and I develop all the time, which is it's basically the same thing what a doctor does. How do we know a doctor is valuable unless we go to the doctor and they do their needs analysis on us? They do their physical exam.
That's right. They start poking and looking into every orifice and taking our temperatures and our heart rate and everything because they want to know really what does this patient need? And the only way to do that is by doing that research. By the way, in today's world, as it always has been, this is one way that you can make a lot of money. How do you get rich in today's world without,
Sure.
being a doctor yourself or inheriting money or robbing a bank? It's by finding a need in the marketplace and then fulfilling that need in some way. So let's start with the way we find that out, Eric.
Exactly. It all starts with doing our identification, maybe what's wrong with the doctor. We call it our needs analysis or our practice analysis. So, folks, if you've ever been on one of our webinars before and you've heard us talk a little bit about a practice analysis, today what you're going to get to experience is us diving into some of these questions and actually not just kind of going through these. We're actually going to show you today some completed practice analysis questionnaires, and you'll be amazed by some of the answers to these questions. And you're thinking, this can't be happening in today's world. But it actually is. And this is where it all starts. Because, folks, if you miss this part, we can tell you right off the bat, you'll never get a doctor. So we're going to kind of take you through what's called our practice analysis questionnaire.
Hey,
So,
that's a
Patrick?
good point, Eric. You just mentioned about getting a doctor. That's the biggest fear that most people have that come through our training, right? What if I don't get a
Exactly.
doctor? And folks, if you do what we teach you to do during that week, we give you a dozen different ways to market to doctors. Then you will get a doctor. There's no doubt about that. But here's one of the things that you have to know. If you didn't go through our training, you wouldn't know that you could ask these questions and get this kind of information. But they will share this with you if you do it the way we teach you to do it. So let's start with that first one that you have up there, Eric. This is interesting
Yeah.
because we've kind of redacted some stuff, but this is an actual form that was filled out by one of our licensees as they interviewed probably the doctor or the office manager. And you'll notice that they already outsourced their billing. Look at that. How do you currently process claims in your office? They've outsourced already. Now that's an interesting point, Eric, because a lot of our people looking into our business wonder if there's a market out there, if doctors are doing it themselves or if they outsourced it. Well, some of them have outsourced. That doesn't
Exactly.
mean they're happy. This is,
Yeah,
in
it does
fact,
mean they're happy.
we probably have more licensees who sign up doctors who already have decided to outsource because they already know the value of doing it. They're just probably not happy with the technology that their current company is using, or the communications, or the reporting. There's all kinds of reasons why people switch, and we switch a lot of doctors to our licensees.
Exactly. And if anybody's been on our webinars, and you're going to listen to this one later because you're going to be listening to it, after we've already gone through this, a lot of people have asked us, so what do I charge? And we've always said 6%. Well, here is a clear picture that we're talking about. We know what we're talking about here because this actual doctor outsources their billing and it's at 6%. Now, on the surface, I'm sure someone's been thinking, well, why would they switch? Wouldn't they want to go with someone cheaper? You want to talk about that before we move forward, because I can hear those questions rumbling in people's heads.
Well, we tell people, our licensees are trained that the range that's out there right now, it does run sometimes 5%, sometimes 7, 8%. Many licensees have signed up at 7 or 8%. But 6 seems to be kind of a national average that's out there. Now, every case is different. This is why a lot of people in this business go into business and then go out of business, because they don't know how to price correctly. And folks, that's what we help you with. We have you send us this practice analysis, and our support people go through that with you and find out whether or not what you're about to propose to the doctor is the correct fee. You don't want to leave money on the table, right? You don't want to go in at 4% or 5% and leave money on the table. But you also want the account. So with our 21 years of experience, we kind of know how to help you make those decisions.
And folks, this is why we want to get this information from the doctor, because guess what the doctor wants to find out from you? What are you going to charge me to do my billing?
Right.
Remember,
I'm sorry.
yeah,
Well,
go ahead.
Like you going to the doctor and or calling them up and saying, "Hey, I've got something wrong with my throat or my chest. How much are you going to charge me?" Well, the doctor's going to tell you, "I can't tell you that until I do the exam. This is the doctor's exam here."
Correct. So be careful that I know that some of that are on our webinar today are going to be coming on board with us. And so this is one of the lessons you're going to learn in our training class is don't throw out the number, and you'll see why here in just a little while. Now, we're going to continue to keep going on. We couldn't fit the entire questionnaire, so we had to kind of break it up a little bit into some screenshots here. But you can see we picked it back up, how do you get your claims, forms, or EOBs? And Patrick, you actually laughed at this.
Well, we used to do that, of course. When my wife and I started doing medical billing back in 1987, there was no, I don't even know we had fax machines back then, but we certainly would go by and pick that information up or have it couriered from the doctor's office to us. Now, with our online cloud-based system, Eric, and our iDocs Now system, we have ways of getting that information, our licensees do, directly from the doctor's office, electronically, directly into your computer without even leaving your house. But as you can see, this particular doctor, that's what this company was doing. They were couriering it from their office. And let's see, what else is pertinent on that one? I guess that's about it for that one, isn't it?
Well, no, actually, this number, this where it varies from 2 to 10, folks, because that's a number you're going to need to know when you put it into the report part of it, because we calculate that as money that the doctor's spending on doing. So that's a key part of it. Now,
that's the number of hours. All of the staff in the office, how many total hours do they put into working with their current billing company in this case to get that information to them? As you can see, they are going to spend some time at it. With our system, they're going to spend a whole lot less time because it's all automated and electronic.
So the next big question is how much do they spend monthly on their cost for software, hardware, upgrades, and support? $3,000 a month.
Yeah, and a lot of people, when they first hear these kinds of numbers, can't believe that a doctor's office is actually paying that kind of money on a monthly basis just to keep their system up to date, their hardware and software, and of course for the ongoing support. With our system, once the doctor has invested in a small setup fee to get involved with our licensees, at that point, all of that just goes away. We don't have a monthly support fee. We don't have all kinds of user fees and software updates. All of that's all inclusive in our cloud-based system. So when we make updates, which is on a regular basis to our system, it's all automatic. The next time somebody logs in, since it's cloud-based, you just log in from any browser into our site, all of a sudden they're using the latest features at no additional cost.
And folks, you got to take in consideration this is $3,000 per month on top of the 6% that they're already spending on someone doing their billing. So there's a cost to use the system and a cost to do the billing.
And look a little bit further down. Do you have a per user fee? Yes. They also paid $125 per user for each person who could get into and access the system. With our system, you have access to allow and put in as many users as you wish, and there's no charge for any of those. So you could have everybody in the office that's involved in the billing, the doctors that are in that office have access to the system to see reporting. All of that's at no additional cost there either.
Right. So that was one sample. Now we're showing some other samples. This one's actually handwritten in here. Again, how much total charges are billed per month to an insurance company? Well, $1 million. How much is on average is collected per month from the insurance company? $350,000 per month. This looks like it's going to be a great account here. And so,
yeah, they're only collecting a 35% of what's billed. And folks are going to find out that that's real typical out there, that they might be billing $1 million and yet collecting only $350,000. That means that they're leaving $650,000 on the table every month. That's lost revenue to the doctor's office. You can get that up to 98%, not 35%.
And then on this one, same one, they're spending $5,000 a month, and on updates, $45,000 a year on top of that. So, folks, we're showing you here that it's very hefty out there for some people to do it. Here's another one that is, again, another outsourcing here. But
I love this little note here that the licensee wrote. Do you zoom in on that, Eric? It's frustrated, says frustrated. Not sure. She,
On insurance verification. Here we go. Yep.
yeah, she believes money is missing, but has no way to find out. So the office manager thinks there's money missing. Like I think we bill more than we're collecting, but I'm not sure, how to find that out. And that's because most software that's used by most billing companies out there is antiquated and doesn't have real-time reporting to show the status of the claims, the status of the money in real time over the internet through a cloud-based system like ours does.
So what we've been able to show you so far is discovering what the need is. That's the big thing that Patrick and I have just been showing you. And then now we're going to talk about the solutions. We're going to talk about both iClaim and EMRX now that work hand in hand. And again, for some other in-depth hearing about the way the system works, there's actually two ways you can learn more about the system. One is go back under our website, under where it says blog, and we've got literally hundreds of other webinars that we've done on showing this of how it actually works. But secondly, the best way for you to be able to know how this works is to schedule a time with your business coach that you're working with. They'll be happy to take you through a live demonstration. Patrick, we were kind of talking about that today, and we kind of mentioned that who in their right mind would go buy a car and never go test drive the car?
Right.
Nobody does it.
No.
So we want to give you the opportunity to basically test drive what we're showing you here.
Yeah, and those live demos that we can arrange to set up for you, we also do those for your doctor. I think we talk about that later. But anyway, let's talk about iClaim itself, Eric, and distinguish between these two different things. One is the billing system itself that allows you to get the claims paid faster. It has real-time access, as I mentioned earlier, through the internet connection. And of course, real-time analytics, which means your reporting is up to date at all times. And I mentioned earlier that you could give the doctor access to go in and see the real-time status of their claims. So they don't lose control by outsourcing to you as they would with a lot of billing companies. And then, of course, it's web-based, as we mentioned, and much more lower claims rejection rate, like I said, less than 2% through our system.
Well, let's first talk about the claims that are paid faster, because again, what we're trying to show you here is that there's been such a delay on doctors getting paid. The average time from when the doctor actually sees the patient to the time that doctor gets paid on that patient could be 3 to 4 weeks. So it averages about 30 to 40 days at times of how they're currently getting paid. So why are we able to get claims paid faster? Well, it's just simply because we own the engine, so to say, that helps get the claim from where we are to the payers themselves. Well, that engine is called a clearinghouse. That clearinghouse, we own that clearinghouse. Folks, we're the only billing platform in America that actually owns its own clearinghouse. That's why we can get claims paid faster. That's why we can have real-time access to the claims themselves. That keeps us web-based, and that helps drive our claims to be lower claims rejected. And because if a claim does get rejected, we actually get to see it in real time. So obviously we get to correct it before it ever gets sent out again to the payer. So that's a huge value of what we're bringing to the table to the doctor.
Yeah, Eric, I had somebody ask me, well, what define real time? What does that mean? I said, well, it means that you're actually looking at the data as if it were happening right now, not in the past. Like this is 3 days ago data. This is the data that's there right now that we see, our clearinghouse sees, the doctor sees, everybody sees it in real time. That's the advantage of a cloud-based system that's connected through the internet versus a system that resides on the hard disk of your computer or the doctor's, that you then batch all these claims in the evening and upload them, and they go to the clearinghouse, and 2 days later you get a report that says, yeah, some were rejected. Ours we know instantaneously.
Exactly, and that's a huge advantage, and that's part of what we like to do for you as a licensee. We actually demonstrate that to the doctors for you, so that's what we're talking about there. in when we're actually doing the demos. Then EMRX. Well, EMRX stands for Electronic Medical Records. So we're talking about the electronic medical records that doctors have to be on. This particular one is very easily customizable. It's 100% integrated with iClaim because it's built by the same engineers that run iClaim and the clearinghouse. So obviously it's going to run. Unlike a lot of systems that you'll find out there, you've got a billing system, and then you've got to link it to its own another third-party EMR system. We're 100% integrated, and if we can remind you what Patrick and I talked to you about earlier in that article, the main thing that the office managers are looking to do come 2016 is to integrate their entire revenue cycle management. We've been there. We're there. So that's why it gives you the springboard to help you get to your doctors much quicker.
Yeah, we've been integrated for the past 7 years when we first came out with the electronic medical records. See, folks, the iClaim is what they call the practice management or the billing software. Think of it that way. This is the software that the doctor actually uses. That's why we're illustrating there on an iPad that the doctor is looking at that x-ray, because the doctor can actually take an iPad directly into the patient, talk with the patient, look at the patient, hold the iPad up, and sorry, pushed over my microphone. I got excited there. And actually tap on the iPad and put the data in directly in so that when you go into the billing side of the software, it's already there. All the codes are there.
Yeah, everything's there, and as you can see, that this can be accessed from any location, anywhere, and keep the secured HIPAA compliance issues where they need to be. Everything stays secure. So remember, as a web-based platform, you're not logging in through a laptop, you're not just accessing the information through a laptop which resides on that laptop. You're literally going through secured portals that are managed, that are secure, so you can literally just be anywhere. A doctor could be anywhere and look at a patient's medical records and still be HIPAA compliant.
Yeah, from any device that's connected to the internet, you can access this data. It's very unusual in today's world to have this kind of accessibility from the doctor, and like you said, Eric, be HIPAA compliant. HIPAA is the standards that the government has set for patient privacy and for security of the data. And this meets all of those and goes way beyond that.
Great question that just come in from Teresa. She's asking, can I do this part-time? And obviously you can. There's a lot of people that get started doing this part-time. Remember, all we're going to do is try to help you get that first client, and that first client may only take you a couple of hours a day to actually process and manage those claims on a daily basis. So yes, you can absolutely do this part-time.
Yeah, I'd say a big percentage of our licensees that come through our training still have a full-time job. So we've learned how to help them build their business part-time. And folks, the kind of revenue that you can bring in from this business, even from just one doctor, could replace your current job. A part-time job, $25,000 to $35,000 a year for the average general practitioner. It's not that hard to replace your current income and your current job.
Exactly. So, folks, we've only shown you 2 solutions so far. We're going to kind of break it down, and we told you we're going to get into a few more of these. And you remember in that article that Patrick and I shared with you at the early part of this integration, one of them is the office staff working a little bit closer with the patients and getting them involved in the whole financial part of the way that they need to get paid as well. We've had Choice Pay. Gosh, Patrick, how long have we had Choice Pay for?
Oh, yeah, maybe 7 years. Yeah.
That's what I was going to say. It's about 7 years, and we've already been developing that. And we've already had this as to help the doctor and the patients with that doctor's cash flow. So here we have an automated system that can help reduce patients' debts by allowing that patient to be set up on what's called a Choice Pay. It automatically can get that doctor paid. It helps increase patient satisfaction. It never sends patients to collections, which who on this call ever wants to be sent to collections? Nobody does.
Nobody.
And especially the doctor doesn't want to do that because they know they've already lost at that point.
Yeah.
So we already have this integrated into one of the solution models already.
Yeah, the patient payment portal, it's called, allows the patient to go in and actually do all that online through a credit card or an e-check or however they want to handle the payments. Okay, Eric, here's a great question from, this is Paramesh and Rima. They're both on here, I guess, a couple. Do you help marketing to get business? Now, folks, we always have that question asked on these webinars. It's a great question. If we could go out and sign up all the doctors in the United States ourselves, we wouldn't be selling a license for you to get involved in the business. We, ABS, American Businesses, is not involved in the medical billing ourselves. We don't do that. But we've learned over the past 21 years how to get clients. And we teach that through licensees who are actually instructors for us that are running their own businesses. And so we know it's proven and we know it works, or we wouldn't be teaching that. And so, yes, the answer is we do help you, teach you exactly how to go out and get the clients that you need. Now, do we go out and sign them up for you? No, again, if we could do that, we wouldn't need you. So we don't get involved in the actual signing of the clients, but we teach you exactly how to do it. It's kind of like, do we give you a fish or do we teach you how to fish? We're going to teach you how to fish and get as many clients as you want.
And I actually want to address Teresa's question because I think it kind of goes right along with that. And Teresa, I'm going to answer your question by asking a question. Would you feel comfortable of someone taking care of your finances and you really didn't know who that person was? Her question is, do I have to go face to face with the doctor or that particular doctor's office? We say yes, because this is a relationship business. A doctor's not going to just turn over their billing to somebody that they don't know, like, or trust. Those are the three key components to building your business here. Well, any business. And hopefully that you'll get the opportunity to go out there, meet doctors, and have them know who you are, learn to trust you, and really get locked in on feeling comfortable with you dealing with their cash, because that's how you get paid. How you get the doctor paid is how you end up getting paid.
Yeah, I think, Eric, this kind of strikes at the fear that people have, though, of going door to door, and that may be what she meant by that. I don't know, but you don't have to go door to door. Although at some point, yes, you're going to have to interface personally with somebody there in the doctor's office. Now, we can get you into that office, though, without you having to knock doors or make cold calls on the phone or something like that. Again, the dozen ways we've figured out how to market this all involved getting to the point where you're doing that practice analysis, and you'll do that in person.
Now, one more thing that we're going to talk about money on helping doctors get paid. We've already talked about iClaim, EMRX, Choice Pay, which is a more proactive way in which we can help the patients pay the doctor. But we also know that there are some ways that we can help doctors not ever have to send their patients to collections, because obviously there are some doctors that have a high accounts receivables with patients, and they need to recover as much money as possible. Nobody likes to send their patients to a collection agency.
Right.
Again, they lose 30 to 40 up to 50% of what they could collect anyway. So we do have another service here called Quick Collect, which, again, it'll never send the doctor's patients to there. It does increase patient retention because, again, the patients don't feel like they're just being drugged through the mud through a collections agency.
Right.
For the doctor, it really helps them recover all of the money that they need. Plus, it's web-based again, and it has a great detailed reporting. So these are some of the services that we rarely go into during a webinar, but today we wanted to show you what you can do after you find that need. You've gone through that practice analysis, and you may find out this is the exact need for the doctor. Quick Collect or the other patient payment program there for you to go through. That's what we're trying to help you with today, is finding the need and putting the right solution right along with that need.
Yeah, doctors don't collect nationwide, but about half of all the money that they bill to patients. And we can take that 50% collection up to 98% collection using some of the tools that we've shown here today. That makes a huge difference in the doctor's reimbursement. And remember, that's their biggest worry right now.
Exactly. Yeah. Teresa, thank you for replying. She goes, it's not a fear that I have, meeting with doctors. She says, I just work late and trying to understand how I would get into a doctor's office during regular business hours when I work until 6. Actually, Teresa, sometimes going in after hours is the best time to go
Yes,
because the doctors can't see you. So you might want to get a hold of that article that Patrick wrote about how to use sales reps to build your business. That's another way that you can actually use some sales reps to help you get into the door, sometimes even after hours.
that's a good point, Eric. By the way, I put that article out for uh, to everybody that's in the medical billing business because I don't think some billing companies even thought about using medical reps. It's just one of the ways that we teach our licensees a different way of marketing their business that most billing companies don't even think about. I've put other articles out there on how to do seminars, for example, and lunch and learns to get clients. There's all kinds of ways that people would never think of if they didn't, get those from us. So we share that with you because we want you to build a business, as fast as you can. And sometimes that means hiring somebody else. There are people who love to go out and knock doors and have the time to do that, Teresa. So if you don't, we'll show you how to find the people who do and pay them on a commission only basis, which means you don't put out any money until they've brought you some business.
She just typed in Patrick saying thank you. that helped
You're
answer her
welcome.
question. So you're very welcome,
Yeah,
Teresa.
good.
Again, because of time, it's 10 minutes till the top of the hour. This one's flying by, but you can see that we've kind of hit on a few of these, but you'll be able to use any of these different services as long as you know what the need is. That's the key element to what we're talking about today. So you're asking why a doctor would even see value in you. It's once you help them uncover what their particular need is, match it up with the proper solution.
Right.
That's the only reason a doctor would ever move forward. Well, even Warren Buffett says this. I know this is one of your favorite quotes here, Patrick.
Yeah, price is what you pay, but value is what you get. Folks, nobody in the whole world thinks that something is, I want to buy the cheapest. I want the cheapest car that I can find.
Right,
Most of us want the nicest car that we can get for the price. And so the
right.
value is what we're really looking for. And that's what doctors are looking for as well. Now, by the way, all of those services that were on the previous slide there, we didn't get time to cover those today, folks, because we just wanted you to know that there are others available that you'll have to go through our virtual brochure on our website to learn more about. Again, we're just limited to an hour on these webinars.
So, folks, again, value is the bottom line. Does the doctor see that there's value? And that's why I said don't quickly share with the doctor what you're going to charge them, because what if you charge them 8%, but you're gaining them 25% more in payments?
Right.
So be careful about pricing and getting into a price war with the doctor on your specific services. Leave that back here to the back end of the value. Patrick, you've kind of put this whole puzzle together here. So I'm going to kind of just step this through as you talk through this, and you're just kind of bringing all these pieces together here.
Yeah, so folks, what it takes to have a hugely profitable business in today's world, at least in our business, it includes, of course, the billing system. You have to have a good billing system, or you wouldn't be in the business of collecting and billing for a doctor correctly. You also have to have the correct electronic medical record system. Ours is the award-winning system that's out there that doctors are, many doctors associations are recommending to doctors.
Right.
Then, of course, as Eric mentioned earlier, we're the only company that has those two pieces, but we also have the clearinghouse as a part of our system. In other words,
Mm-hmm.
we own the clearinghouse and have the ability to clear those claims ourselves, not having to send it to a third party like most billing companies and most software has to do. And then, last but not least, we have the people behind that. After you've got the right systems like we have, now you have to have the people that can support you And folks, we're the only company that has the live training workshop and ongoing training through webinars like this one for our licensees. We hold those on Friday, by the way, and they're recorded, of course, if you can't make those, so that we have ongoing weekly training for our licensees. That's very important to success in any business. And I don't know of many franchises that do that, Eric.
No, no, I can't think of it either. And again, you know, let's just talk quickly about, you know, the difference between a franchise and a business opportunity. And what you get from us is all of this without having to worry about franchise fees and royalty fees. Folks, wouldn't it be nice to build a business and really, in reality, a six-figure income without having to worry about franchise fees or royalty fees as part of your business of what you have to do? Obviously, if you've got some type of Subway sandwich shop, or I just had a friend of mine, Patrick, that just bought in with an Allstate insurance company. Well, he's got a great business model, spent a lot of money, and plus on top of that, he has to pay a franchise fee to Allstate. Folks, what you're getting with us is like getting a franchise without having to spend the franchise fees because of the people that we have supporting on the back end. Patrick, you want to kind of talk about our business model, how we continue to keep getting reimbursed and supporting our support team in order to support our licensees?
Yeah, I see one of the questions here is, what is the initial investment requirement? Well, folks, we do have a licensing fee of $24,990. Let's round that to $25,000. That's what it is, right? Folks, that is probably the biggest question you'll have by the end of our training class or about midway through is, why is that fee as low as it is? I mean, yes, it is some money. For most people, that's a lot of money. But it's not when you compare it to sandwich shops and other types of Allstate and the Century 21. Those types of franchises run, to $250,000 or more. But ours is low because of the model that we've built for our business. You remember all those services that we showed on the previous slide there? All of those we make money on. So as you offer those to the doctors, we are being paid by our technology partners behind the scenes a few pennies on each one of those transactions. Well, believe it or not, those pennies add up pretty fast. We've got a nice, healthy revenue on the back end now that comes from those services, and that's why we are vitally interested in you signing up as many clients as you can. We make money when you make money. That's the American way.
That is the American way. And so, folks, we've eliminated you having to worry about paying us a franchise fee and a royalty fee. There's no monthly fees that you pay to us. There's nothing that you pay to us. You've got the one-time fee of the $24,990, and that's it. There is no other franchise fees, no royalty fees, no percentages. Get out there. Let us help you get that doctor. That's why we'll do as many demos for you as possible, because we know if we can help you win, we'll eventually win on the back end because you're actually doing the billing for the doctor. So that's why we want you part of our entire team. That's why... Go ahead.
I'm sorry. So it's almost like we're partners with you. Becoming one of our licensees, you become partners with us in building our business as well. The difference is that you'll be making a whole lot more money on each client than we are, but we make enough on the back end to help us stay vitally interested in your success.
And that's why we're going to show everyone right now that providing the right order of structure, which is get the need analysis done, the practice analysis done, providing the right solutions, putting and matching that where the doctor sees value in saying, you know what, I need you. Here is one right here. This is an actual agreement with a doctor from one of our licensees, signed the contract right there. There was a non-recurring initial setup for thee, but there were some other things that they actually agreed to right there. And there's their first check, nearly $7,400 of getting paid by the doctor. So, folks, that's what we like to see. That's your money.
Yeah.
When you get that $7,400, none of that comes to American Business Systems.
That's made out to you. You put that in your bank account.
Exactly.
And that's just the initial setup fee that the doctor pays. then of course you're going to be making that 5, 6, 7, 8% on their billing every month, recurring, for as long as you have them as a client.
Exactly. So, folks, it truly is as simple as needs, solutions, value. You can't get to the value until you uncover and understand what the needs are for the doctor. That's why Patrick and I started off today by sharing with you 2 major articles that have come out here recently. We want to show you that there is an actual need out there. We've got the solutions, matching that up with us here at ABS with our training team, which, as Patrick has already said, we actually use a licensee to teach you, because she's already built her business. Why not have her teach you? It's not theory, it's true reality of what can be done and build those type of businesses and eventually get down to that particular value and that doctor paying you.
And we even have some quotes here from doctors who've seen the value. These are actual clients of some of our licensees. Here's Dr. Ashley Kakmak says, my billing was horribly tedious and very time consuming. When I outsourced my billing, I was able to get my headache away. I can track what's happening with each and every claim online 24/7 at my convenience. There you go. Here's another one. This is Dr. Johnny Walker. I know you think we're making that up. Isn't that a liquor of some kind? But this is a real doctor. He says, in this day and age, with all the complexities of medical billing, I can't imagine doing it any other way. That is, doing it in-house. At this point, a good physician has to decide when to delegate responsibility. So he's delegated that responsibility to one of our licensees who's, doing this billing. And then one more here from Donna Catanzaro. Medical billing is very difficult unless you outsource. To do it in the office would take a lot more time and money. It's allowed me to get better reimbursement on my claims because I have an entire billing company behind me to check claims and follow up on them. They have a wonderful online system that allows us to check on claims, update patient information, and much more. And this is just a few doctors. This is just 3. Guys, we've got all kinds of doctors from coast to coast that will be glad to even speak to your prospective doctors and give them their testimonial as to why they've decided to outsource their billing.
So as kind of wrap up here, we've gone right to the top of the hour here. So let's get to, because I know some people have to hop off here, but a lot of people are asking, and it kind of goes along with Kevin's question here. He says that the $25,000 cover the cost of on-site training. It doesn't cover the on-site training, but it does cover the training that we have. But let's talk about what they actually receive through training, Patrick.
Yeah, once you've come to the training workshop, which, by the way, he may be asking about travel, you have to pay your way here. And, of course, there's a small hotel bill. I think it runs about, maybe $700 for the week. But, yes, that's not included in that $25,000 fee, Kevin, if that's what you're asking. But we also encourage people, that's a very small investment to come down here for a week and find out if this is for real. Because, guys, people on these webinars like us, we can be telling you anything, right? The way you find out for sure is you come and you sit through that week, and if at the end of the training workshop, here, look, I'm reading it word for word, for any reason you do not think this business is right for you, simply tell any staff member and they'll arrange for you to receive a full refund of your license fees. So folks, I don't know of any company who's willing to do that. Let you sit through the whole week, see all their proprietary information, get all the handouts and books and things we hand out during the week, and then still ask for your money back at the end of the week.